Welcome back to the Meet and Support, everybody. We're talking about childhood cancer today, an issue that unfortunately has been in the Augusta headlines far too much in the past couple of years. We've known several young children who are battling it, and today we're doing our part, we hope, to try to bring some attention to it and bring some awareness as to how you can help down the road. Dr. Ted Johnson is with us now. Dr. Johnson is a professor of pediatrics at the Medical College of Georgia, and I appreciate you being here. And I know that your official title is, I think, Assistant Professor of Pediatrics, but no, you are a Professor of Pediatrics, and I hope none of the supervisors get mad at me for that, but you do. You do a world of good educating people and also helping everyone understand the issues that children face medically, and I thank you for being here.
Thank you very much for having me.
Well, it's my pleasure. I want to ask you some questions that, first of all, will hopefully educate me first, and that is, what's the importance of bone marrow? We hear about bone marrow transplants that Brennan Simpkins and others have undergone, but what's bone marrow itself do for a human being?
Bone marrow is important for people because it makes new blood cells to repopulate the bloodstream. There are three types. There are red blood cells that deliver oxygen to your tissues. Mm-hmm. There are platelets, which help you clot your blood, and there are white blood cells, which help you fight infection, which are quite important. Cancers of the bloodstream and the bone marrow, like leukemia, take over the bone marrow and co-opt its ability to make new and viable blood for the bloodstream and the body.
So in Brennan Simpkins' case, he has AML. That is, if I understand it correctly, when abnormal white blood cells inhibit the bone marrow's ability to generate those new good cells you talked about, and the bad blood cells are winning.
That's right. The cancer in his case grows in the bone marrow and eventually crowds out the normal bone marrow and keeps it from doing its job of repopulating the bloodstream.
So when you have a bone marrow transplant, are you extracting every bit of bone marrow that person has and replacing it?
Actually, we just need a small portion of the bone marrow from a donor so that that bone marrow is very rich in a particular type of cell called a stem cell, which can become any of the three types of main blood cells. So that that concentrated preparation of stem cells, when transplanted into a recipient who needs it, can actually repopulate the entire bone marrow and the bloodstream.
I want to clear something up while we're talking about stem cells. Tell us the different ways that you can harvest those cells and use them, because you hear stem cells, and some people watching would think, oh no, controversy, I'm against that. Please explain that aspect of your approach.
Sure. So the controversy that exists is with embryonic stem cells, and we're in no way talking about those. These are adult stem cells that grow after you're an adult. We do harvest cord blood from babies who are freshly born. Again, those are not embryonic stem cells, but it's a rich source of adult mature stem cells that can be used for bone marrow transplants. The second place that we get stem cells from is actually the other two places are from adult donors or child donors, and two ways to do that. One, you can give donors medicine in order to mobilize those stem cells from the bone marrow into the bloodstream, and then you can harvest them straight from the bloodstream. Mm-hmm. And the other way is to harvest them from the back of the hip bone with a needle. That's usually done under anesthesia.
And then the hope is that the healthy, good, infused cells take over and run that person's body.
That's right.
And they get healthy.
That's right, and that's called a graft. So when the bone marrow is infused, it takes a few weeks for it to engraft and to begin to make new blood cells.
Cancer, leukemia, does not discriminate. It affects all people. In today's case, we're talking about children. But there's not a whole lot of diversity when it comes to donors. Tell us about the needs that you all see in the medical community for a more diverse donor base when it comes to bone marrow.
Yes, well, first of all, children like Brennan, when the need arises for a bone marrow transplant, it's really not an optional intervention. So there is either a donor available or there's not a donor available. And so those lead to some hard decisions sometimes. In Brennan's case, he's had 3 transplants, so he's had some availability of donors. You're more likely to find a match from someone who's related to you by heritage. Mm-hmm. In other words, if you come from the same ethnic group. Unfortunately, the African American and Hispanic groups are underrepresented in the donor registry right now.
They're not even on the list.
Well, they're very low. Caucasian patients are about 90% likely to find a donor match. African Americans, for instance, are only about 60% likely.
Let me ask you this. When a person goes to one of the bone marrow registry sites that we're going to set up next Wednesday, it doesn't mean they're going to donate bone marrow. Please help clear that up.
Right, that's absolutely right. All we do with the registry is collect some cells in order to extract DNA, and that's done with a cotton tip swab that we brush on the inside of the cheek. That DNA goes into a registry, and that information is available when a physician is looking for a bone marrow match for a patient that they may have who needs a bone marrow transplant.
Okay, so you come out and you get swabbed, and your name is just going to go into a database in the event that you were ever needed. Let's say that phone call comes and they say you're a match. Is that person's health going to be in jeopardy? Is that person going to be in any sort of pain if they agree to the procedure? What happens if they say we need you?
Well, first of all, you'll have a discussion about timing and availability. And for a variety of reasons, sometimes donors are not available, but we always hope that they are. If you are able to donate, then we would start to set up the donation process, and depending on the patient and the patient's disease, we would choose the harvest method. So either from the peripheral blood or from the bone marrow with from the back of the hip bone. We would have to make that decision at that time.
Is there anyone who could know before they think about signing up that they would not be eligible to donate? Anyone who you know just can't be on the list?
Well, typically, if you have active health issues that make you a poor risk for anesthesia, one, if you're not able to donate blood, you're not able to donate bone marrow either. And certainly if you have any known genetic diseases that run in your family or a history of cancer yourself, you would not be a viable donor.
And how much, I know you probably don't have a percentage, but how much does this boost a patient's chances of surviving and doing well and turning around from their disease versus not having that bone marrow available at all?
Yes, it really depends on the child and the disease in order to give hard and fast numbers. But children who are in need of a bone marrow transplant, typically it's a life-saving procedure.
Well, I know that we're going to get a lot of people out at our registry drive, and I know in just a minute you're going to show us how simple it is. The mayor has volunteered to be our first bone marrow registry signee. I don't want to say donor because it's not what happens, but he's going to show you how simple it is in just a moment. But before we get to the mayor, I do want to thank you for all that you do and all that MCG does. That's the Simpkins home base, and it's where they started their treatment with Brennan and still depend on it heavily when they're in this area, and I appreciate everything y'all are doing.
Thank you very much.
All right, Dr. Ted Johnson is going to be right back with us. Mayor Deke Copenhaver is going to be right back with us, and we are going to show you how simple it is to take part in this bone marrow registry drive. What a thing that the Simpkins family and a lot of others would be thankful for during this month of Thanksgiving if you'll please take part. We'll be right back in just a moment to show you.